How does HPV coat testing work for cervical cancer detection? Imagine a simple test that can give you a clearer picture of your cervical health. That's what HPV coat testing aims to do. It combines two important tests during a routine pelvic exam to better assess your risk for cervical cancer. The first is the Pap test, also called a Pap smear. This test looks at cervical cells under a microscope to find abnormal or precancerous changes. It helps detect cellular changes that could develop into cancer if left untreated. But the Pap test doesn't detect the virus itself. That's where the second test, the HPV test, comes in. It checks for the presence of high-risk types of human papillomavirus, especially HPV-16 and HPV-18. These two types are responsible for about 70% of cervical cancer cases. The HPV test looks for the DNA or RNA of the virus in cervical cells, indicating an infection that might cause cellular changes over time. During a coat testing procedure, both tests are done at the same time, usually during a pelvic exam with a speculum to collect cervical cells. The Pap test finds abnormal cells, while the HPV test detects viral infection. If either test comes back positive, it signals a higher risk for cervical cancer. This may lead to further checks like a colposcopy or more frequent monitoring. Coat testing is especially recommended for women aged 30 and older because it improves early detection of precancerous changes. The combined approach provides a more complete picture than either test alone. For example, a woman with a normal Pap test but positive high-risk HPV might need closer follow-up. Conversely, if the Pap shows abnormal cells but the HPV test is negative, her follow-up plan might be different. This strategy aligns with current medical guidelines that focus on early detection and prevention. It targets both the viral cause and the cellular effects, helping identify women at higher risk before cancer develops. It's important to remember that HPV infection is common and often clears on its own. But persistent high-risk infections increase the chance of developing cervical cancer. Coat testing helps identify those persistent infections early. In summary, HPV coat testing works by simultaneously detecting high-risk HPV infections and abnormal cervical cells, offering a more sensitive and comprehensive screening method. This approach supports early intervention, reduces the risk of cervical cancer, and saves lives through timely medical care. Always consult your healthcare provider for personalized advice and screening recommendations based on your health history.